Hello again, everyone. As we continue getting our message across via these communications lines, I thought it was important for us to come on, myself as well as OMD, come on and talk about the coronavirus and some of the things we're doing and what we'll continue to do. I think as you're taking in these threats and this risk analysis of coronavirus and some of the patients we may become in contact to, I would like it if you separate these two issues into two parts. The first issue is how we best analyze, assess, and intervene for our patients and where we would actually take these patients to it. So I think you need to become very familiar with what those rules are and how we qualify those patients and how we identify those patients and what we do with them. And the second most important thing that we need to realize and become very familiar with is how we treat ourselves after the fact of coming in contact with someone that's identified as having COVID-19 or is suspected of having it. So as you're looking at these different protocols, keep in mind what's the best way to take care of the patient and then what's the best way to take care of yourself. Chief Fatone with OMD has a lot of the details and he'll be up next, but some of the things that I think they're important is continue to be vigilant and cleaning our surfaces, cleaning our equipment, washing your hands, protecting yourselves, and just as important, if during this process, if you're sick, take care of yourself and stay home. Without further ado, I'd just like to say it's very important, and you guys know it's very important, you act like this daily, is take care of our patients and always take care of yourself. Be safe. Thank you.
Hi team members, this is Ralph Fatone, Deputy Chief of Medical Services for Polk County Fire Rescue. Today I've been asked to talk a little bit about the coronavirus that's been in the news, and specifically to Polk County Fire Rescue's response to this coronavirus outbreak within the United States and how we're going to respond to it on a local level. I think the first thing is that you need to understand is that the United States, we have experienced coronavirus outbreaks in the past with minimal effects. We've had the SARS and the MERS coronaviruses in years past, and again, producing very little effect to the United States as a nation. And for both of these outbreaks, Polk County Fire Rescue had never come into contact with a single patient. That's not to mean that we should not be aware of the possibilities of interacting with a coronavirus patient, and it certainly doesn't mean that we shouldn't take all the proper steps to protect ourselves as responders. Much of the information that we have put together has come specifically from the Center for Disease Control, and if you ever have a chance, you should look on their website. It has a tab for healthcare providers and for EMS response specifically. So this video is not meant to encompass the entire treatment parameters and the entire response that we would expect from you and that you should expect from administration. We will be releasing all of this information later today through Target Solutions, as well as an updated viral alert clinical care guideline that will be released today with the other administrative policies associated with this outbreak. And next week we'll have hard copies of the clinical care guideline protocol to be distributed to each of your stations. First thing I want to talk about is our dispatch center has initiated a viral alert questionnaire for patients that call in who are categorized as feeling unwell or flu-like symptoms. They will do the initial screening of specific questions related to coronavirus 19. If the patient answers positive to these questions, dispatch is going to alert you via telemetry while you're en route to the patient and advise you that this patient may be a possible viral alert, and please read your CAD notes where additional information can be found. This should trigger you that prior to entering the patient's house or residence, you should don the appropriate PPE. The appropriate PPE is an N95 mask for yourself, eye protection, gloves, and a gown. Now, again, I'm not going to go into the whole process because there's a lot of information that can't be shared on this, that can't, time restraints on this video prevent us from going over the whole process, but please, you will have this process available to you later today. The concept is we want you, if you already know that you have a possible viral alert patient, we want to have limited contact with responders with the patient. So the paramedic will don the PPE, go in and assess the patient, and then ask the same questions to see if they actually do meet the category of a possible coronavirus patient. If so, and they can ambulate with the assistance of a single rescuer, we just want the single rescuer to be in contact with that patient. If other crew members are needed to perform emergency procedures or to assist with lifting and such, then only the amount of responders needed should don their PPE and go in there and assist the patient. Again, more information on that will be coming out to you. I want to talk about the coronavirus 19 screening tool that we have. Again, all this information comes from the latest CDC metrics, okay? So the number one question that the very first question that they have to answer, which is positive, is have they had recent travel within the last 14 days to one of these coronavirus 19 outbreak areas? And those areas are, as of right now, China, Iran, Italy, Japan, and South Korea. If they don't have this travel history, they will not meet the qualifiers to be looked at as a possible coronavirus 19. It's very important. If they do meet that recent travel history, then they'll need to meet 2 of the next 4 criteria: a temperature greater than 100.4 degrees Fahrenheit, oxygen saturations of less than 93, capnography of less than 32, or a cough of greater than 10 times per minute. Basically, respiratory effects or respiratory signs and symptoms. So, number 1, did they do the recent travel to those areas? Number 2, did they meet 2 of the 4 qualifiers? If they do meet those qualifiers, then they're considered a patient under investigation for the coronavirus 19, which means we continue with our proper PPE, we treat the patient signs and symptoms, we do just regular care that we would usually do for these patients, and we initiate to the initial receiving hospital and to dispatch that we do in fact have a positive viral alert patient. This will allow the initial receiving facility to assemble their team and have the patient put into the proper rooms and with the proper protection. Okay. Now, after you deliver the patient, and again, this is not everything that needs to be done, but in general, you want to, after you deliver the patient, you need to immediately notify your battalion chief. He's going to notify our infectious control officer. Those 2 together are going to help you and guide you through the rest of what is needed for you to do immediately. You're going to finish your report. You're going to maintain your PPE, your surgical mask, your N95 mask. You're going to keep that on. You're going to avoid contact with anybody else around you. Don't let other crew members come up to you and start talking to you about what's going on. Kind of isolate yourself from other people. Again, continue wearing your mask. Do the paperwork. The battalion chief is going to meet you. He's going to give you a exposure package to fill out. All of the regular exposure type processes are in place. Now, the hospital is going to take your patient and do further testing and screen them further for a possible coronavirus to see if they're actually a candidate for the coronavirus 19 testing. Two things will happen to your patient. They'll either say that they are a candidate and they're going to send the source blood to a CDC lab in Tampa, or they're going to determine that they in fact don't meet the criteria. If they don't meet the criteria, you'll be released back to work without any issues. Now, process is going to take 3 to 4 hours. So during that time, you're going to disinfect your truck. You can return to the station, but again, stay away from other responders. Stay outside the station. You're going to use the Clorox 360 system to further disinfect your ambulance or your apparatus, and then again, hopefully by then we'll know if they're going to source test this patient for the coronavirus 19. So, if the hospital deems it not that it's not this type of patient, they're going to be in contact with our infectious control officer. You're going to be released back to work. There's not going to be any issues. If in fact they do believe that there's a possibility after further examination this patient may be positive, they're going to send that blood over to Tampa. You're going to be out of service. You're going to remain out of service. The employee that has the contact with, or employee or employees that have contact with the patient, they're going to be sent home to what's called at-home self-isolation. Okay? Now, again, a little bit more details can be about what an actual in-home self-isolation can be found on the CDC website. But in general, just keep yourself away. If you have family, if they want to go to the friends or relatives' house during the 24-hour period, that's certainly acceptable. If not, just stay in the bedroom. Okay? Just stay a little, and when the family brings in some food or something, maybe put on your surgical mask. It's not an absolute quarantine. It's just an isolation. We'll have the test result in 24 hours, and we'll let you know whether that patient tested positive for the coronavirus 19 or not. If they don't test positive, rest assured you have not been exposed and you're released from your self-isolation. If they do, in fact, do test positive, and I'll remind you, out of 350 million Americans, only 99 have tested positive. It's a very low risk. Then you'll be self-quarantined for 14 days, and further instruction will be provided to you if, in fact, that's the case. Again, I want to advise you can find this and a lot of more information on the CDC website at www.cdc.gov/coronavirus 2019. We will be releasing some more detailed administrative processes and the new CCG, or the updated Viral Alert CCG, later today. Obviously our main concern is the employee's safety. But again, I want to remind you, through all the hyperbole and news that you're seeing on the TV, this is still, in the United States, is a very low risk outbreak or infectious outbreak. So take a deep breath, and we appreciate all that you do. Stay safe, and look for the additional information.